Good morning. This course is going to be on glaucoma diagnosed, treatment started, but then we know that glaucoma is a chronic, lifelong blinding disease if we leave it unchecked. So we're going to look at the nuances of what we do once glaucoma is treated, because glaucoma is such a potpourri like all of us are, and there's so many underlying diseases which just has a common pathway of optic nerve damage, so we don't treat all of them the same way. So what this course is going to be and what we're going to look at is why people go blind from glaucoma. And it's still underdiagnosed, we know that. In the US and the Australia, we just heard from the previous speaker, about 50% are undiagnosed from population studies. In our country, the incidence is as much as 90%. Glaucoma is still inappropriately treated, and this is the segment that this course is going to try and address. And of course, the third component is the lack of compliance despite your telling them what. So then what we're going to look at now is the severity and prognosis, why it is underestimated, why sometimes there are less aggressive therapeutic interventions and what appropriate therapeutic interventions should be, what follow-up visits should be, and what to do if there's insufficient IOP reduction, actually how to assess what IOP reduction is, and also the difficulties in assessment of progression, because at the end of the day, you want to be sure that it's not progressing to blindness. So on this course, we'll have Dr. Pandav taking us through which glaucomas are most blinding, because if you diagnose something which you know is a dangerous sort of glaucoma, your follow-up is going to be different compared to something which you think is not as dangerous or more innocuous. Dr. Nangia will take us through factors at baseline that can predict progression. Dr. Rita will talk about what IOP is adequate for whom and how do I decide. And Dr. Mayuri will take us through how do I decide how often do I call back my patients. And then Dr. Harsh will take us through the best tools to monitor progression in different stages of the disease, because it's not the same for everybody. And then we'll probably wrap it up with a few case studies and we'll go through what the panel thinks. So I invite the panel, Professor Pandav, Dr. Nangia, Dr. Rita, Dr. Mayuri, Dr. Mayuri is here, Dr. Harsh, to please come on stage. And we have Dr. Nitin Verma, so I think we can have the keynote right at the beginning and then we'll carry on with the course as it were. He's going to, yeah. Oh, I'm sorry, Dr. Pandav needs to go, so I think Dr. Pandav will go through which glaucomas are most blinding, and then we'll have Dr. Nitin Verma who will talk about neovascular glaucoma, so that will be a sort of continuation. So Dr. Pandav, please.